Hello, my name is Dr. James R. Golding of Somerset County Chiropractic and Acupuncture Center here in Somerville, New Jersey. And you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. We're out of the studio here today and on location in our Somerville facility, celebrating our 30th year of clinical practice here. And the reason why we have you on location today is that we have an exciting topic, and that topic is digital diagnostic imaging. Within the past few months, we removed our standard X-ray machine, which had been a fixture in the office since I'd been in practice, and we installed digital diagnostic imaging. It's a state-of-the-art imaging system that allows us to get a resolution of the spine, internal structure that we were never able to get before. And I'm happy to bring that to you here today. We're inside the imaging center here now, and I'm going to do an explanation and a demonstration of the machine and what its capabilities are. Now, as opposed to what we used to do, which was take an X-ray that was in what they called a bucky, which was an instrument that held a cassette, which held an X-ray film. Once we took that film, we would then take that into our darkroom and develop that using chemicals and go through a whole arduous process. That wasn't something we could automatically do on the fly with treating patients, and the quality of the image was limited by the technology that was available. Latest technology now is that they've come up with this particular device. This is a digital scanner, and just imagine that you had the highest resolution digital camera where they had 10,000 pixels on a little square, and then what we did was we magnified that into a humongous plate in which we had like 1 trillion pixels on this square. Those pixels, or that portion that picks up the image, is so condensed in its ability to enhance a visualized image that it's like nothing else before. So what happens is, and you'll see in a moment when we demonstrate, we're using standard X-ray equipment along with the digital imaging device, uses small amounts of X-ray and then magnifies that to an image that we can manipulate and condense and do wonderful things, which we're going to show you coming up. The beauty of this system is that the degree of clarity is unsurpassed. It's eliminated our need for additional imaging, practically 90%. And also, what you're going to see is that the information that we get is instantaneous. So we don't have to do any retakes. We get all of that information. So when a patient comes in, whether they have a chronic condition or an acute condition, we're getting that information instantaneously. Once we're in motion with the camera, when we take a picture, by the time we get to reposition the patient for the next view, as you'll see coming up, we're already getting the information on a visual screen that's allowing us to see exactly what's going on. Hang with us. We'll be right back. With me, as usual, is Dr. Kenneth M. Kirsten. Dr. K, pleasure, as usual.
Happy being here.
We just went from the recording device for the digital imaging, and now we're in the control center that gives us that we're going to work all that equipment with. Between the last shot and now, what we did was we took a lateral neck X-ray on a patient, and we're now going to go through the process of what it looks like when we're actually scanning the patient. Dr. K?
So basically, after we decide what image we're going to take, we go to the scan screen and we pick the series that we're going to do. So we picked our cervical spine and we did a lateral. What this does is this allows it to put in the factors that are pre-programmed into this computer, the factors that we've taken with the screen, and that gives us a buffer area to allow us to process the film. So now when we hit the scan, our image will pop up of what the one we just took. So it takes about 15 seconds in total for us to process an image, which would take us 15 minutes to do before, where we'd have to actually take the x-ray, take the whole series of x-rays on plates, which means actual films, take them out of the room, bring them into another room, and then process it like in a dark room. So that's all eliminated.
Right.
And another
plus there was potential for human error, involved in each one of those steps along the way. And the beauty of it with this now is that we have no retakes, we have perfect images, we eliminate a tremendous amount of equipment and chemicals and all of that.
And so the time that we just talked, the image is processed and completed already. So we would click on the image, and we have our x-ray. Now at this point, it'll tell us by looking at some aspects of this whether we were underexposed, overexposed, and we can look at it in this manner. If we look at patient information overlay, that we could be underexposed here, okay, or overexposed, and it tells us, but it really doesn't matter. It just gives us a good buffer to tell us what images to take for certain body types, because after we're done with this, now we can manipulate the image. So now we'll manipulate the image by taking that away, and we go by our cropping down the image. We can actually change the density of the image. Now we're looking at a cervical spine or a neck and a side picture. And what we're looking for here, in general, like with general x-rays, we're looking for arthritis, degenerative changes, soft tissue injury, soft tissue swelling. That's what's the beauty of this, because it allows us to really see extensive amount of soft tissue, which we couldn't see before on the x-rays that we take in the old analog days. So now, if we want to look at and isolate certain parts of this cervical spine, we could actually just magnify it. And we could bring this all the way up to look at one segment if we want, which was impossible before, because before we'd have a plain film that we took and we were stuck with it. Developed it. If it came out incorrectly, then we'd have to actually bring the patient back in, re-x-ray it, redevelop it. That could actually sometimes take 2 visits sometimes. So right now, we can do this right away. And on this image, we can actually see, just going right into clinical information here, I actually see there's actually some calcification of a disc here. We could actually see here in this area, and I could blow this up even more by hitting shift, and we can focus at like a magnifying glass and look at that.
We can go right inside as far as the clarity goes.
We could even see that there's some calcification of the cartilage tissue that's in between these 2 vertebrae here. Also, now, again, we could play with this all day, this image, if we want. We also have the ability to invert the image, which we'll look at some more soft tissue. So if we invert this, now we could see the esophagus. Here's a bone called a hyoid bone, which you typically don't see in a typical x-ray. We could see the dental work of a patient. You could see everything. And you could actually see the trachea and the esophagus here. This is a soft tissue, which is important in motor vehicle accidents or trauma. You could actually, an indication with that would be distension or displacement of this organ here when we have cervical swelling or significant trauma. So if we see that this angle is too large or there's too much spacing in between this, then we know that there's a severe injury. This patient needs emergency care. And we can actually go back, and now we're going to re-invert it, and we can actually do some things like measuring. So we go to annotations and measurements, and I can measure from here to here. And that will give me...
There's norms within the body.
It'll give me, this is 17.330 millimeters. And we could change it, and these are just other clinical information which we can examine, and it gives us instantaneous information. If we wanted to send this to a radiologist, we could do it 2 ways. We could actually email for a second opinion, or we can typically burn the disc, burn these images on a disc, and send it out with the patient before they would go for an MRI, things of that nature. So if we wanted to make certain annotations, we could say, let's get rid of this annotation. We'll delete that, and we'll say, let's look at, I want to evaluate for this calcification here. I could actually put here what I'm looking for. So I would want to evaluate for this maybe density or calcification in here. So I could click on this area, circle it, and then write something in it in a dialog box here, like please eval. And then I could take my arrow and kind of say, there you go. Yeah. So it tells us exactly without sending a report, or it gives us instant communication by just burning this on the disc and sending this to a radiologist or a second opinion.
Right. I mean, it's just wonderful. It allows us to really communicate well with them with what's going on. And like we mentioned before, we're no longer having to store X-rays. A patient wants a copy for their own records. We burn them a disc. They have it right then. Many times in the summer, people would check their X-rays out, leave it in the car. They would be temperature sensitive. It would get hot in the car, and things would get messed up. But the degree of clarity is what is most important with that.
It also allows us to view things that we probably weren't able to see before. Again, the magnification is very important for us in regards to evaluating small areas. For example, we had a patient that had foot pain for about 3 weeks. We took an X-ray. In the old days, we take a picture. This is what we get. We get the exact image of what we see here. Looking at this at a glance, it looks completely normal. The pain in the patient was in this area. So before, we would say, okay, well, let's come back in maybe 4 more weeks, or let's evaluate it, or send you for an MRI because we couldn't see it. But now we can go all the way up and magnify, and at this area we can actually see a fracture in this toe. The line comes up here and comes down here, which we would never ever be able to see before. If we invert it, it kind of helps us look at that little whitening line in here too. So in the past, this would be basically undetectable type of fracture in a toe. So we're able to examine that, look at that. We can magnify it. Even if we magnify it here, you can actually see it a little bit better here.
I had a case the other week where somebody had sustained a hockey injury, and they injured their tibia. And when I did the image, we had suspected a fracture, and there was no displacement of the tibia or the leg bone. But when we actually went inside of the bone with the machine, we saw a fracture line that was not displaced into there, and we would have never picked that up on a plain plate film before. And the interesting thing was that before this device, we would play it safe and say, okay, you can't play hockey for 3 weeks. We're going to stabilize that, put that in a boot just to make sure. After having that degree of imaging, I was able to say, listen, you're going to be in pain for 3 weeks, whether you play hockey or don't play hockey, and your foot is stabilized in the boot, and it's fine to go ahead and do that. So I mean, that's something that we would never be able to do that, and as just as far as having that degree of clarity before.
Non-displaced fractures are the most difficult to see because there's no displacement of the bone, and if you're not getting a good quality image, you can't see that. And in this case also too, we have a patient here that actually had a tumor on her spine, and looking at it in a regular traditional analog image, unable to see. But if we look at it here, we can see the difference in between this bone and this bone. We can see kind of like a half circle line here. So that would indicate a red flag. What doesn't look like the other. We can also see here that there's actually a displacement of this bone going forward. So we know that there's a weakness at this level. So before we would say, oh, this patient may just have a slight what we call spondylolisthesis or anterolisthesis, or slippage forward of the vertebrae. But what's causing that? In this image, we can actually determine by inverting it, we see a significant whitening here, and that would indicate a soft tissue tumor that's growing actually out of the spinal column and around. So we can allow to send this patient to a neurosurgeon or an MRI and get some other imaging, which we may haven't done in the past, because we would look at this and say, looks pretty normal to me, other than a simple displacement of the L4 vertebrae.
Just the ability to manipulate these images has just given us such a magnificent toolbox.
And again, we can measure angles now, like we were shown before. We were seeing the difference in the heights and images. We can draw, again, heights and compare hip heights from side to side, so we can tell a patient how much of a patient, like, well, how much am I uneven, or so
what's
we could
leg length difference,
we can basically draw a line, right? We can draw a line from here to here, and actually measure that. So we can draw a line from here. We know we're flat because it's even here. Get this even, and then go up to here, and then we know that the patient has a pelvic unleveling of, a very small millimeter length, 164.72 millimeters, and difference in pelvic height.
The interesting thing with dealing so much with scoliosis was that before this we would get out the marking system. We'd be drawing lines and then comparing it, but even with doing it exactly by hand to the best of our ability, there was still a margin of a degree, 2 to 3 degrees, where you could be off even if you did everything correct. Whereas with this particular system, it allows us to get, if someone's got a 17-degree curvature, we'll know it's exactly 17 degrees. And then if we had to take a re-image 6-8 months later, we can exactly measure whether that condition's getting worse, staying the same, getting better, to a fragment of a degree.
And again, this is another aspect of what I love about changing the quality of the image. I had an athlete in here that was complaining of back pain, and he's had some treatment before, unexplained back pain, it's just recurring. And if we took this image, it's slightly underexposed here, and we take it, we say, well, we kind of see it, we could get a good enough image where we can see the spine. But now if we take it and we crop it down, and now we can actually, instead of retaking the film, look at this, darken this up, we can actually see a glaring problem here where this young athlete actually has what we call a pars defect, or a fracture right here in the posterior aspect of his spine. And this allowed me to basically refer him immediately for an MRI, and we actually found out through an MRI that he has this on both sides. He has a bilateral pars defect. So we're looking at images, again, in a different manner. It's just so much more clinically immediate. It allows us to give patients information right away and helps us with managing their care or case, and actually determine whether to adjust this patient or not on their first visit. I mean, when we're talking about fractures or displacement and things of that nature, we're not going to adjust or manipulate that patient on their visit until we know further. So it allows us to say, okay, it gives us more confidence in regards to how we're going to treat that patient that day when they come in here, particularly in acute cases.
You know what I just wanted to mention, because Dr. Ken and I were talking about this the other day, of what makes a good chiropractor, and a big part of it comes down to is knowing when chiropractic care is not indicated. And that's part of what this is, what this form of imaging brings to us, is that if something that we can see, it's something that is disease or disorder oriented, or something that is beyond the nature of conservative care, and we get that information instantaneously, there is, less. It just allows for us to be more effective, and not only that, but it gives us much more reasonable information to tell people what their rate of recovery is going to be based on potential underlying weaknesses of the spine. Like if somebody just has a sprain, strain to the back and has some malalignment, but there's some complication associated with osteoarthritis, it may take that condition longer to heal. So we know that right from the get-go. So when patients come in and they say, well, how long is it going to take? Well, this is just such a highly advanced tool that gives us that information of, how long is it going to take, what their expectations for treatment should be, whether we should institute additional rehab type of things. I mean, it's just awesome.
Yeah, like in the old days, like we were mentioning before, I mean, basically an evaluation could sometimes even take 2 days. We'd take x-rays of a patient, we'd develop that film, then we look at the films, and the patient would come back to the next visit and then go over the films with the patient then. Sometimes we're able to develop the films at the time, but again, it was a thing that if it came back, then we'd have to redevelop it. It's just it's helped out with not only just with diagnostic imaging in regards to basically diagnosing a patient, but it just speeds up communication between us and the other medical community, because all the other imaging centers are digital, with MRIs, and we can, again, just burn this on a disc. They have the instant image, and then we're allowed to communicate with the radiologist in a more readily manner.
Mm-hmm. How about showing that osteoarthritic cervical spine from the side? So, gives us a greater idea. The image is so clear that what we took on, we can actually tell what expression the patient had on their face when we took the image. I mean, that's just the way that it is. It's just so clear where we see the actual outline of everything. But going on to the osteoarthritic cervical spine.
We're showing degeneration here at this level with some bone spurs and an actual what we call anterolisthesis on this vertebrae. We can actually see this vertebrae is not lined up correctly. Due to the degeneration, we have what we call an anterolisthesis. This is slipped forward, and it's not proper alignment with a reverse cervical curve. So, and again, it's just one of these things that just allows us to do so much detail. We can manipulate it. We can flip it. We can invert it upside down. We could rotate it. This is more valuesome in extremities. So it just allows us to kind of even have some fun with an image when we're done with it. Mm-hmm. And patients like it because it's patient information. The patient wants to know what's going on with them when they come in. So when they come in, we can actually show them, and they really like it because they like to see what's going on with themselves when they come in and get answers when you come into and what they're being treated for. And even if it doesn't show us anything clinically significant, we could say, look, this is there's nothing clinically significant here in regards to why you shouldn't respond to care in a really reasonable amount of time because there's no significant degenerative changes or pathology going on in here.
Yeah. The other thing that was great, too, is that we have we put a larger screen up over here, and what that allows us to do frequently, the patient will come in, but they may either have a spouse or their parents are with them. So this allows us, which we can put multiple images up on the screen at one time, and we can educate the patients and their family on the nature of the problems, so that we're not all huddled around a little computer. This gives us 57 inches to allow for multiple images to occur. And this way, we can explain in sequence the nature of the problems or the condition that's going on, and that's just been a very, very helpful tool. If it's strictly a matter of spinal malalignment, we can use this model that helps us to demonstrate actual malpositions, so people don't. It's just not us just talking about it. I found that if we can. Patients understand more clearly visually when they can see what's going on as opposed to just talking about it. And so just bringing all of this room to fruition like this has just brought a different dynamic into the practice that is just, representative of where we should be after 30 years.
And also, too, again, when we burn these onto a disc, the patient could take these home, and they could actually manipulate the image themselves to a certain degree, too. So they could even show their spouse or their child what's going on with them. When by doing some manipulation, it's very limited what they can do, but they can actually change the quality of the image themselves and play with it at home.
Separate from the fact of taking an image for something that's brought someone in to see us. Let's say they injured their neck or injured their spine in a particular location, or suspected fracture or a disease. The part of the miracle of this product is that it allows for us to image the peripheral surrounding tissue, and the amount of information that we get that regarding a person's health that is outside of what brought a person in to see us is absolutely tremendous. We never used to take a chest film before. Like, we would take films of the dorsal spine and for evaluation of bony elements, but we were always uncertain when it came to the need to take a chest film because we didn't want to miss anything on anybody. And what we find now is that we have the instrumentation that allows us to not miss anything because the degree of clarity is just insurmountable. I mean, it's just really something else. This tool has given us dynamic that a patient comes in, whether a patient, if they come in as a new patient and they need imaging, we can do it right at that time. We can discuss it at that time. If treatment's indicated, there's a clear need for treatment at that time. I mean, it gives us a distinct advantage in helping patients make a decision on, what to do, where to go for therapy and treatment, whether they're in the right place, and we think that this is just a marvelous adjunct that we're pleased to make you aware of. For Natural Healthcare Alternatives, I'm Dr. James R. Golding and Dr. Ken Kirsten, and thank you for viewing.